Hi friends, welcome back to the channel. If you're new here, my name is Chizal. I am a plastic surgery resident at New Delhi, and on this channel we talk about health, productivity and tech that makes our lives better. If you've ever been to a hospital, you must have signed multiple documents, and one of them must have been an informed consent. Do you know what it is and what is its value for doctors as well as patients, and how it can help us reduce the communication gap that we have between doctors and patients if it is done how it is supposed to be? That's what we are talking about today in this video, the importance of informed consent and why we should take it seriously. Let's begin. As a young doctor, I noticed that one of the main reasons for dissatisfaction among patients and legal suits against doctors is a lack of communication and a lack of foresight among the patients. Yes, there are medical misadventures in the hospital which the doctors cannot predict, but most of the things that you see when you visit a hospital are done as per a set protocol, and there are consent forms for each procedure being done for a patient. Especially in a country like India where faith over doctors still exists, and although it is decreasing in the last decade or so, but still patients and relatives sometimes tend to overlook the possibility of complications that may arise from the treatment. And the doctors also sometimes fail to bring it to the notice of the relatives. I'll be very honest, as a doctor, I have taken informed consents without explaining even 10% of the information that was supposed to be passed on to the relatives. But they still signed it with just a brief explanation, probably because they trusted me, or it was an emergency situation, or they just didn't feel the need to read a document completely. If you are one of those few patients who do read such documents completely, thumbs up to you, and I'm sure you had a better experience and a better understanding of what is being done at the hospital. So let's get into the details. What exactly is an informed consent? So as per definition, informed consent is the process in which a healthcare provider educates a patient about the risk, benefits and alternatives of a given procedure or intervention. Now focus on the word educate here. It is not about a doctor telling you something and you just signing a paper. You must understand what is being done and what are the consequences of that particular procedure. You have every right to know. In fact, we doctors really appreciate if a patient wants to understand it from us directly rather than asking Dr. Google about it. You may not understand the pathophysiology of a disease, or you may not understand the details of the surgery that you are going through, but an informed consent done right can drastically reduce the gap between what your doctor understands and what you understand about a particular condition. Now there are a lot of medical legal aspects to it, so I won't go into the detail, but let's just list out some of the common instances where you will be asked to sign an informed consent. For example, to undergo a particular treatment at the hospital, to undergo specific procedure, a surgery, blood transfusion, anesthesia, vaccination, blood tests. And also, if you want to get some radiological investigations like CT scan, MRI, ultrasound, you might be asked to give an informed consent for that as well. And when an informed consent is obtained, the process should include describing the proposed intervention, emphasizing the patient's role in decision making, discussing alternatives to the proposed intervention, discussing the risks of the proposed intervention, and taking the patient's signature. Now, signatures are present in files of all patients, but was the patient well informed? That's the big question. We need to focus more on communication and less on signatures. Now, for communication, language sometimes becomes a barrier because the consent must be taken in the patient's own language. That is sometimes not possible. The patient must be explained in his or her own language. That becomes difficult sometimes, especially in a country like India where we have so many languages. So that is one problem. But as far as possible, we try to take consent in the patient's own language. Now, there is another term that we need to understand is the implied consent. This consent is suggested or implied by the patient's own actions. It does not explicitly need to be stated or written down. For example, if you visit a hospital, say for fever, it is implied that you have come there for treatment. We do not need to record that you want the treatment. It is implied. But if you need a particular test for your condition, like say an MRI or a CT scan, or if you need to undergo a surgery, this is when an informed consent comes into the picture. And in cases of emergency, an informed consent may not be taken due to inadequacy of time for a life-saving procedure. And if the patient is incapacitated or not in the condition to give a consent, his or her family members are supposed to give an informed consent. So that is what an informed consent is. I'll share some anecdotes with you to have a better understanding of how this informed consent works. I remember as an intern, I was asked to take consent from a patient for his gallbladder removal surgery. I went to the patient, I had the consent form in my hand, and I started translating all the points of that form to the patient. He got so freaked out. He said, no, I just want my gallbladder removed. I don't want to take all these risks. I don't want to go undergo this surgery. No, please cancel the surgery. These doctors will kill me. I don't want it. Maybe I did not explain it to him properly, or maybe I exaggerated the risks that I was explaining. But all that I did was read out what was written on the form that he was about to sign. This patient was ready to undergo the surgery the next morning. something without understanding the risks at all. He was fine. He was ready to sign the paper if I did not translate it to him completely. But suppose if anything went wrong, this patient would have created a ruckus in the hospital because he has no idea about the possible complications. He is not ready to undergo that surgery. There is a huge communication gap here between what the doctor is going to do and what the patient is expecting. Over time, my communication skills have obviously improved, and now the patients do not refuse directly when I go to take consent for surgery. But I also sometimes skip a few points which I think will make the patient conscious or will scare him for that surgery. Should I not? That's the big question. So this is what I'm trying to communicate here. The doctors should also make an effort to make sure the patient completely knows what is going on, and you as patients should also make an effort to read the document carefully and be informed of whatever you're consenting for. If you read it completely, you will get a better understanding of what is going on, and if you have any doubt, you can clarify it with your doctor and the nurses. The doctors also sometimes take it for granted that this is implied. Now the difference between an implied and informed consent gets blurry sometimes. So this is what creates problems. So let's make an effort from both ends, from the doctors as well as the patient, to reduce this communication gap and stay well informed. The faith that you show on your doctors keeps the doctor-patient relationship very pious, but sometimes just faith isn't enough, especially when things don't go as planned. We need to be prepared and we need to be well informed. So that's all I wanted to say in this video about informed consent. And if you have seen this video so far, I hope you will read the informed consent form completely next time when you visit the hospital, and make sure you have a good understanding of what is going on for a patient. My name is Chizil. You are watching The Tech Doctor.